Question 1. Scenario-based question. Mr. Stephen, a warehouse worker, has been experiencing persistent low back pain due to the heavy lifting required in his job. After consulting with the company's occupational health nurse, Mr. Stephen is advised to undergo fitness for duty evaluation to determine if he is fit to continue performing the duties required of his role. Based on the nurse's findings, the worker may need adjustments to his job duties to accommodate his medical condition. What should the nurse consider when advising Mr. Stephen about his return to work? A. Recommend full return to work without any modifications as long as Mr. Stephen does not report any other health issues. B. Advise Mr. Stephen to return to work with modified duties that limit heavy lifting based on the fitness for duty evaluation. C. Suggest that Mr. Stephen stays off work for an extended period until he is completely pain-free. D. Instruct Mr. Stephen to take over-the-counter pain medications before return. Work and resume all tasks without restrictions. Answer. B. Explanation. The nurse should base the advice on the results of the fitness for duty evaluation, which may indicate that Mr. Stephen is capable of performing modified duties with restrictions. In this case, limiting heavy lifting is a reasonable accommodation that protects the worker's health while ensuring productivity. Full return to work without modifications may exacerbate his condition, suggesting extended time off. C. Without evaluation or return to work plan may cause unnecessary delay, and recommending the worker to take pain medication and perform all duties without modifications. D. Could put Mr. Stephen's health at risk and may violate workplace safety guidelines. This approach is not in alignment with disability management and the objective of providing safe, sustainable return to work plan. Question 2. Which of the following is the most effective strategy for preventing work-related musculoskeletal disorders (MSDS), a high-risk manufacturing environment? Implementing ergonomic workstation assessments and adjusting tools and equipment to minimize strain. B. Encouraging employees to use over-the-counter pain relievers when experiencing muscle soreness after shifts. C. Setting up frequent break schedules but leaving the workstation design unchanged. D. Providing additional training on physical therapy exercises to employees after experiencing MSDS. Answer. An explanation. Ergonomic workstation assessments are the most effective preventative measure for reducing musculoskeletal disorders in high-risk environments. This approach addresses the root cause of MSDS, such as repetitive strain, awkward postures, or improper tool usage. By adjusting workstations, tools, and workflows, the physical strain on employees is reduced. Simply encouraging pain relievers, B, does not address the underlying cause of MSDS, and setting up breaks without modifying workstation design, C, may provide temporary relief but not prevent long-term issues. While physical therapy exercises, D, can aid recovery, prevention through ergonomics is the primary strategy. Question 3. Which of the following is not a key element to consider when developing a comprehensive workplace wellness program aimed at improving employee health and reducing absenteeism? Encouraging regular exercise and providing on-site fitness facilities. B. Implementing a smoking cessation program with appropriate support and resources. C. Mandating strict weight loss goals for all employees to improve health. D. Offering mental health programs and resources to help manage stress. Answer. C. Explanation. While promoting wellness is important, mandating strict weight loss goals for employees, C, is not a recommended practice. Such a policy could potentially lead to discrimination, psychological distress, and employee dissatisfaction, and it may violate anti-discrimination laws. Successful wellness programs focus on providing support, resources, and education without imposing unrealistic or harmful goals. Exercise, A, offering smoking cessation programs. B, and providing mental health resources. D, are all effective components of a wellness program as they focus on overall well-being, health promotion, and providing employees with the tools needed for improvement in a supportive manner. Question 4. Which of the following is the most critical element to consider when evaluating the effectiveness of an occupational health and safety program within a workplace? A. The number of employees enrolled in the health and safety program. B. The number of safety violations or accidents reported in the workplace. C. The percentage of employees who actively participate in safety meetings. D. The reduction in work-related injuries, illnesses, and absenteeism. Answer: D. Explanation. The effectiveness of an occupational health and safety program is best measured by its impact on reducing work-related injuries, illnesses, and absenteeism. D. This outcome directly reflects the program's success in mitigating workplace hazards and improving employee health and safety, while enrollment A. Participation in safety meetings, C. and reporting of safety violations, B. are important indicators. They do not measure the program's impact on reducing adverse outcomes, which is the ultimate goal of any health and safety initiative. Question 5. Which of the following OSHA regulations is directly aimed at ensuring employees are protected from hazardous chemicals in the workplace? A. The Bloodborne Pathogens Standard. B. The Respiratory Protection Standard. C. The Hazard Communication Standard, 8CS. D. The Personal Protective Equipment Standard. Answer: C. Explanation. The Hazard Communication Standard, 8CS-C, is directly aimed at ensuring employees are informed about and protected from hazardous chemicals in the workplace. This regulation requires employers to provide information on chemical hazards through labeling, safety data sheets, SDS, and employee training, while the other standards, A, B, and D, are important for addressing specific health and safety concerns such as bloodborne pathogens, respiratory protection, and personal protective equipment. They do not specifically address chemical hazards in the same comprehensive way as the HCS does. Question 6. What is the primary purpose of pre-employment health screenings in an occupational health program? A. To assess the current health status of the employee and provide immediate treatment. B. To ensure that the employee is fit for the specific tasks required by the job. C. To identify potential workplace hazards and make recommendations to management. D. To provide a baseline for future health monitoring and track changes in health status over time. Answer: B. Explanation. The primary purpose of pre-employment health screenings, B, is to ensure that the employee is physically and mentally fit for the specific tasks required by the job. This includes evaluating whether the worker can safely perform the duties of the position without risking injury or illness, while tracking health status over time. D, and identifying workplace hazards, C, are important components of occupational health programs. They are the primary focus of pre-employment screenings. Immediate treatment, A, is not typically part of the pre-employment health screening process. Question 7. Which of the following is considered a best practice in managing and preventing work-related stress in the workplace? A. Reducing work hours for all employees to minimize stress. B. Offering stress management workshops and counseling services. C. Ignoring signs of stress until employees bring them up. D. Focusing solely on physical health to prevent stress-related illnesses. Answer: B. Explanation. Offering stress management workshops and counseling services. B is considered a best practice in managing and preventing work-related stress. Proactively addressing stress through education, resources, and support helps employees cope with workplace challenges and maintain their mental health. Reducing work hours for all employees is not a viable solution for managing stress, as it may not address the root causes of stress. Ignoring signs of stress, C, and focusing only on physical health, D, both fail to address the holistic nature of stress, which involves both mental and physical health factors. Question 8. When dealing with an occupational injury, what is the most important step to take immediately after the injury occurs? They document the incident and begin an investigation into the cause. B. Provide first aid and medical treatment to the injured employee. C. Notify local authorities and file a report with OSHA. D. Ensure that the injured employee is removed from the workplace and sent home. Answer: B. Explanation. The most important step immediately after an occupational injury is to provide first aid and medical treatment to the injured employee. B. Ensuring the employee receives appropriate care is paramount to prevent further harm. Once medical care has been provided, documentation A, notifying authorities, C, and determining the cause of the incident, D, are all necessary steps, but they are secondary to ensuring the employees and safety. Question 9. What is the primary goal of the Americans with Disabilities Act (ADA) in the context of occupational health? A. To ensure that employees with disabilities receive accommodations to perform their job duties. B. To provide financial compensation for employees injured on the job. C. To guarantee that employees with disabilities are not subject to workplace discrimination. D. To mandate that all employees receive the same level of medical benefits. Answer. Explanation. The primary goal of the Americans with Disabilities Act (ADA) in occupational health is to ensure that employees with disabilities receive reasonable accommodations to perform their job duties. This may involve modifying the workplace environment, adjusting job tasks, or providing assistive technologies, while preventing discrimination. C is a key element of the ADA. The law's primary focus in the context of occupational health is on accommodations that allow individuals with disabilities to work safely and effectively. Options B and D are not related to the ADA's specific mandate in the workplace. Question 10. What is a key consideration when conducting a workplace health risk assessment for a manufacturing facility? A. Ensuring that employees have access to personal protective equipment (PPE) at all times. B. Identifying and evaluating hazards related to chemicals, machinery, and ergonomics. C. Ensuring all employees complete annual health screenings regardless of their role. D. Focusing primarily on employee mental health issues and stress management. Answer. B. Explanation. When conducting a workplace health risk assessment, it is essential to identify and evaluate hazards related to chemicals and machinery and ergonomics. B. These factors are directly related to the physical risks employees face and must be assessed to mitigate the potential for injury or illness. Providing PPE is important but does not replace the need for comprehensive hazard identification. While employee mental health is important, it is not the primary focus during the risk assessment, which centers on physical workplace hazards. Annual health screenings (C) are a useful tool, but they do not substitute for assessing environmental and job-specific risks. Question 11. Which of the following is a critical component of an effective workers' compensation claims management system? A. Denying all claims until the employee's injury is fully healed. B. Providing immediate financial compensation for the employee's lost wages. C. Coordinating care and facilitating timely return to work process for the injured employee. D. Focusing only on the financial aspects of the claims and neglecting the employee's medical treatment. Answer. C. Explanation. Coordinating care and facilitating a timely return to work process. C is a critical component of an effective workers' compensation claims management system. This approach helps employees recover and return to work as soon as it is safe, which benefits both the employee and the employer. Denying claims and focusing only on financial aspects. D. Neglect the well-being of the employee and the goal of rehabilitation and compensation for lost wages. B. May be necessary, but it is secondary to ensuring proper medical care and a sustainable return to work plan. Question 12. When designing a workplace wellness program, which of the following should be the primary focus to ensure employee engagement and long-term success? A. Offering free health screenings and flu shots. B. Providing financial incentives for employees who attend wellness events. C. Creating a comprehensive program that includes education, resources, and ongoing support. D. Focusing solely on physical health, such as exercise programs and nutrition workshops. Answer. C. Explanation. The primary focus in designing a successful workplace wellness program should be on creating a comprehensive program that includes education, resources, and ongoing support. C. This holistic approach addresses a variety of health factors, including physical, mental, and emotional well-being, and ensures that employees remain engaged over time, while offering health screenings and providing financial incentives. B. Encourage participation. They do not provide the sustained support that a comprehensive program can offer. Focusing only on physical health. D. Neglects the mental and emotional aspects of employee well-being, which are equally important. Question 13. In the event of an employee injury that results in a workers' compensation claim, what is the most important first step for an occupational health nurse to take? A. Immediately report the injury to the Occupational Safety and Health Administration (OSHA). B. Provide first aid and assess the severity of the injury. C. Begin an investigation into the cause of the injury. D. Complete the workers' compensation paperwork. Answer. B. Explanation. The most important first step when managing an employee injury is to provide first aid and assess the severity of the injury. B. Immediate medical care takes priority to prevent further harm and stabilize the employee's condition. Reporting the injury to OSHA and completing workers' compensation paperwork. D. Are necessary but secondary steps following initial medical care. An investigation into the cause of the injury is also important but should occur after ensuring that the employee receives proper medical attention. Question 14 scenario. Mr. Thompson works in a factory and has been experiencing symptoms of repetitive stress injury, such as tingling in his hands and numbness in his fingers. He has been using tools that require constant gripping for prolonged periods. After discussing with his supervisor, Mr. Thompson is advised to report the symptoms to the occupational health nurse. As the occupational health nurse, what would be your best course of action in this situation? A. Suggest that Mr. Thompson rest his hands and continue working while monitoring his symptoms. B. Recommend that Mr. Thompson see a specialist for further evaluation and discontinue using the tools. C. Advise Mr. Thompson to continue working but limit his use of the tools to avoid further strain. D. Document the symptoms and recommend that Mr. Thompson undergo physical therapy immediately. Answer. B. Explanation. The best course of action is to recommend that Mr. Thompson see a specialist for further evaluation and discontinue using the tools until a thorough assessment is completed. B. Symptoms of repetitive stress injury should be taken seriously and appropriate medical evaluation is necessary to determine the severity of the injury and the appropriate treatment. Simply resting or limiting tool use and C. May not address the cause or prevent further damage. Recommending physical therapy. D. Without a proper diagnosis or specialist's evaluation could be premature and potentially harmful. Question 15. Which of the following is the primary responsibility of an occupational health nurse when developing a program to manage workplace exposure to hazardous chemicals? A. Ensuring that employees are provided with personal protective equipment, PPE. B. Conducting regular chemical exposure assessments and ensuring compliance with OSHA regulations. C. Offering voluntary counseling and stress management sessions for employees. D. Training employees on proper use of fire extinguishers in case of chemical spills. Answer. B. Explanation. The primary responsibility of an occupational health nurse when managing workplace exposure to hazardous chemicals is to conduct regular chemical exposure assessments and ensure compliance with OSHA regulations. B. This includes identifying potential chemical hazards, monitoring exposure levels, and ensuring that the workplace complies with OSHA's hazard communication standard and other relevant regulations. While providing PPE is essential, it is part of the broader strategy of managing exposure, not the primary responsibility. Counseling, C, and fire extinguisher training, D, are important but not directly related to managing chemical exposure. Question 16. Which of the following is a key consideration when conducting an ergonomics assessment in the workplace? A. Ensuring that all employees have access to ergonomic chairs. B. Identifying and correcting tasks that require awkward body movements or excessive physical effort. C. Providing ergonomic tools to employees who request them. D. Evaluating employee job satisfaction and morale related to their physical work environment. Answer. B. Explanation. The key consideration when conducting an ergonomics assessment is identifying and correcting tasks that require awkward body movements or excessive physical effort. B. This helps prevent musculoskeletal disorders and other ergonomic-related injuries, while providing ergonomic chairs and tools. C. Can contribute to employee comfort. These measures alone do not address the broader needs of task design and physical exertion. Evaluating job satisfaction. D. Is important but is not the primary focus of an ergonomics assessment, which centers on optimizing tasks and work environments to reduce physical strain. Question 17. When assessing a worker for fitness for duty, which of the following factors is least likely to be considered in determining their ability to perform their job safely? A. The worker's current physical health status and any medical conditions. B. The worker's history of alcohol or substance abuse. C. The worker's personal lifestyle choices such as exercise and diet. D. The worker's ability to perform the essential job functions without posing a safety risk. Answer. C. Explanation. The worker's personal lifestyle choices, such as exercise and diet, C, are generally not the primary factors considered when assessing fitness for duty. While these factors can influence overall health, the focus of fitness for duty evaluations is on the worker's physical health status, A, history of alcohol or substance abuse, B, an ability to safely perform job functions, D, without risking harm to themselves or others. Emphasis is on medical conditions or impairments that could affect job performance, not on personal lifestyle habits that are not directly related to job tasks. Question 18. Which of the following best describes the role of an occupational health nurse in managing workplace stress? A. The nurse should solely focus on referring employees to external mental health professionals. B. The The nurse should assess the impact of workplace stress on employees and recommend strategies to reduce stress. C. The nurse should provide on-site counseling services for employees dealing with stress. D. The nurse should encourage employees to avoid discussing work-related stress with their coworkers. Answer B. Explanation. The best description of the occupational health nurse's role in managing workplace stress is to assess the impact of stress on employees and recommend strategies to reduce stress. B. The nurse can offer guidance on stress management techniques, promote healthy coping strategies, and work with management to improve work conditions. While referring employees to mental health professionals is an important role, the nurse's involvement is limited to just referrals. Providing on-site counseling C is not always within the scope of the nurse's role unless they are specifically trained. Encouraging employees to avoid discussing stress D could lead to further isolation and worsen the problem. Question 19 scenario. Ms. Garcia works in a warehouse where the temperature fluctuates between extreme cold and hot conditions. Recently, she has experienced symptoms like dizziness, nausea, and fatigue while working outdoors during hot weather. She reports these symptoms to the occupational health nurse. What should the occupational health nurse do first in this scenario? I recommend that Ms. Garcia take a day off and drink plenty of fluids. B. Assess whether the symptoms are related to heat exhaustion or heat stroke and provide immediate first aid. C. Send Ms. Garcia home to rest and recommend a follow-up visit to the doctor. D. Advise Ms. Garcia to wear more clothing to protect herself from the sun while working. Answer B. Explanation. The first step is to assess whether Ms. Garcia's symptoms are related to heat exhaustion or heat stroke. B. These are serious conditions that require immediate attention, and the occupational health nurse should provide first aid to manage the symptoms and prevent further complications. Heat exhaustion symptoms, such as dizziness and nausea, should be treated promptly by cooling the individual and ensuring they hydrate, recommending rest, A, or sending Ms. Garcia home. C. May delay necessary treatment, advising her to wear more clothing. D. Could worsen the situation by preventing the body from cooling down. Question 20. Which of the following is a primary purpose of health surveillance programs in the workplace? A. To assess the effectiveness of workplace safety regulations in preventing injury. B. To monitor the overall health of employees and identify potential work-related health issues early. C. To ensure that employees comply with workplace health and safety policies. D. To provide ongoing medical treatment for employees with chronic conditions. Answer B. Explanation. The primary purpose of health surveillance programs in the workplace is to monitor the overall health of employees and identify potential work-related health issues early. B. These programs help detect early signs of occupational diseases or health problems before they become more serious, allowing for timely intervention. While assessing the effectiveness of safety regulations is important, health surveillance specifically focuses on monitoring employees' health, ensuring compliance with policies, C, and providing ongoing medical treatment, D, are secondary to the core objective of early detection of work-related health issues. Question 21. Which of the following is the most appropriate intervention when an employee reports feeling overwhelmed and unable to focus due to workplace stress? A. Recommend that the employee take a break and consider seeing a counselor for further support. B. Encourage the employee to work through the stress and avoid taking time off from work. C. Suggest that the employee take medication to alleviate symptoms of stress. D. Advise the employee to talk to their supervisor about their stress without offering other support. Answer A. Explanation. The most appropriate intervention is to recommend that the employee take a break and consider seeing a counselor for further support. They providing immediate support, such as a break, can help alleviate symptoms of stress, and suggesting professional counseling ensures that the employee gets the help they need to manage stress in the long term. Encouraging employees to work through stress. B. Can worsen their condition. Recommending medications may not be appropriate without a medical diagnosis. While speaking with the supervisor, D, can be helpful. It does not address the immediate need for stress management or professional help. Question 22. Which of the following would be the most appropriate course of action for an occupational health nurse when an employee reports symptoms of A potential work-related injury, such as back pain after lifting heavy items. A. Advise the employee to rest and refrain from further lifting. B. Immediately refer the employee to an external healthcare provider for diagnosis and treatment. C. Assess the employee's condition and determine if the injury is work-related, and then initiate an appropriate intervention or referral. D. Encourage the employee to continue working while using back support belt. Answer. C. Explanation. The most appropriate action is to assess the employee's condition and determine if the injury is work-related, then initiate an appropriate intervention or referral. C. The nurse should conduct an evaluation to understand the nature of the injury, whether it's related to workplace activities, and if immediate treatment or referral to healthcare provider is necessary. Advising rest without proper assessment A. may delay proper care. Referring immediately without assessing the situation B. might not be necessary if the issue can be managed in-house. Encouraging the employee to continue working D. could worsen the injury. Question 23. A significant spill of hazardous chemicals occurs in the workplace. Which of the following is the first step that the occupational health nurse should take in the emergency response process? A. Evacuate the area and call emergency services. B. Provide first aid to affected workers and evacuate the area. C. Assess the situation to determine the extent of exposure and the need for personal protective equipment (PPE). D. Review the safety data sheets (SDS) for the chemical involved before proceeding. Answer. C. Explanation. The first step in responding to a hazardous chemical spill is to assess the situation to determine the extent of exposure and the need for personal protective equipment (PPE). C. The nurse must quickly evaluate the situation to protect themselves and others, ensuring appropriate PPE is used while reviewing the SDS. D is crucial for understanding the chemical's hazards. It should occur immediately after the assessment of the situation, evacuating and providing first aid, and B are essential but should follow quick assessment to identify the immediate risks. Question 24. Which of the following best describes the role of the occupational health nurse in addressing environmental hazards such as air quality and noise in the workplace? A. The nurse should ignore environmental concerns and focus solely on employees' medical care. B. The nurse is responsible for conducting regular environmental assessments and recommending appropriate controls to minimize risks. C. The nurse should wait for management to take action before addressing any environmental concerns. D. The nurse should only report environmental issues to external regulatory agencies and avoid any further involvement. Answer. B. Explanation. The occupational health nurse is responsible for conducting regular environmental assessments and recommending appropriate controls to minimize risks related to air quality, noise, and other environmental factors. B. It is part of the nurse's role to ensure safe work environment and actively participate in identifying and addressing hazards. Ignoring environmental concerns A. or waiting for management action C. result in ongoing health risks. While reporting to regulatory agencies D. is important, the nurse should also take an active role in addressing the issues internally. Question 25. Scenario. Mr. Thompson, a warehouse worker, has recently been diagnosed with carpal tunnel syndrome after prolonged repetitive use of machinery. He has been referred to the occupational health nurse for evaluation. During the assessment, the nurse notices signs of strain and discomfort in his wrists, but Mr. Thompson insists that he can continue working without any modifications. What is the best course of action for the occupational health nurse in this scenario? A. Allow Mr. Thompson to continue working, but advise him to take breaks periodically. B. Recommend immediate job modification or work restrictions to prevent further injury even if Mr. Thompson disagrees. C. Send Mr. Thompson back to his regular duties and defer to the healthcare provider for any further recommendations. D. Advise Mr. Thompson to seek a second opinion from another healthcare provider before making any changes. Answer. B. Explanation. The best course of action is to recommend immediate job modification or work restrictions to prevent further injury. B. Even if Mr. Thompson disagrees. Occupational health nurses are responsible for ensuring the safety of workers, which may require them to recommend work modifications or restrictions to prevent the condition from worsening. If left unchecked, carpal tunnel syndrome can result in permanent damage. Simply allowing Mr. Thompson to continue working A. or deferring to the healthcare provider C. could compromise his health. Seeking a second opinion D. may be useful but should not necessary interventions. Question 26. Which of the following is the most appropriate method for preventing exposure to hazardous materials in the workplace? A. Rely on employees to take responsibility for their own safety and protection. B. Use personal protective equipment, PPE, and implement engineering controls such as ventilation systems. C. Conduct periodic medical surveillance and ignore the implementation of environmental controls. D. Inform employees about the risks but allow them to decide whether or not to use PPE. Answer. B. Explanation. The most appropriate method for preventing exposure to hazardous materials in the workplace is to use personal protective equipment, PPE, in conjunction with engineering controls such as ventilation systems. B. Engineering controls aim to reduce exposure to hazardous substances at the source, and PPE is the last line of defense when exposure is unavoidable. Relying solely on employees to take responsibility, A, or ignoring environmental controls, C, may result in inadequate protection. Allowing employees to decide whether or not to use PPE, D, could lead to exposure and health risks. Question 27. An employee reports experiencing severe headaches, dizziness, and nausea after being exposed to high levels of noise in the workplace. Which of the following steps should the occupational health nurse take first? A. Recommend the employee take time off and avoid any noise exposure. B. Conduct an immediate hearing test to assess the severity of hearing loss. C. Administer pain relief medication and advise the employee to continue working. D. Assess the work environment for noise levels and refer the employee for further evaluation if necessary. Answer. D. Explanation. The occupational health nurse should first assess the work environment for noise levels and refer the employee for further evaluation if necessary. D. The nurse must evaluate the environmental hazard, in this case excessive noise, and determine if further medical assessment is required. Recommending time off without assessing the cause of the symptoms, it might not address the root of the problem. Conducting a hearing test, B, is part of long-term monitoring, but may not be the immediate priority in this situation. Administering pain relief medication, C, is inappropriate without understanding the underlying cause of the symptoms. Question 28. A worker in an office setting reports feeling overwhelmed and experiencing stress due to high workload and lack of support from colleagues. As the occupational health nurse, what would be your first course of action? It advised the worker to take a leave of absence from work to manage stress. Implement stress management programs and provide resources for mental health support. C. Recommend that the employee speak with their supervisor to resolve the issue directly. D. Encourage the worker to adapt to the environment and not take any further action. Answer. B. Explanation. The most appropriate course of action is to implement stress management programs and provide resources for mental health support. B. Occupational health nurses should support employees by offering coping mechanisms and access to mental health resources, rather than immediately advising a leave of absence, which may not address the root cause. Encouraging direct conversations with a supervisor, C, might be helpful but should be combined with professional support. Encouraging adaptation to stress without addressing it, D, could lead to further health deterioration. Question 29. Scenario. MS. Ramirez, a nurse in a busy hospital unit, reports persistent symptoms of respiratory irritation, including coughing and difficulty breathing, after working with cleaning agents and disinfectants. She is concerned that her condition may be work-related. How should the occupational health nurse respond? A. Recommend that MS. Ramirez take a few days off and avoid working with cleaning agents. B. Refer MS. Ramirez for an immediate evaluation and initiate environmental assessments for exposure to respiratory irritants. C. Advise MS. Ramirez to use a face mask while working with cleaning agents and continue working without further intervention. D. Tell MS. Ramirez that the symptoms are likely unrelated to her work environment. She should consult her primary care provider. Answer. B. Explanation. The occupational health nurse should refer MS. Ramirez for an immediate evaluation and initiate environmental assessments for exposure to respiratory irritants. B. It is crucial to investigate the potential link between the symptoms and the work environment, especially if they are consistent with a known hazard, in this case, cleaning agents and disinfectants. Advising time off without proper evaluation or environment assessment could delay the identification of the root cause. A face mask, C, may be useful, but a more thorough evaluation and preventive measures are needed. Dismissing the work-relatedness of the symptoms, D, could result in inadequate care. Question 30. In the event of a workplace emergency involving a hazardous material spill, Which of the following is the most crucial step in the immediate response? A. Ensure that all employees are wearing appropriate personal protective equipment, PPE. B. Evacuate all personnel from the area and activate the emergency response plan. C. Wait for a supervisor to arrive before taking any action. D. Immediately begin cleaning up the spill regardless of the substance involved. Answer. B. Explanation. The most crucial step in the immediate response to a hazardous material spill is to evacuate all personnel from the area and activate the emergency response plan. B. Ensuring the safety of all employees by removing them from potential harm is the top priority. PPE is essential but comes after evacuation and ensuring no further exposure occurs. Waiting for a supervisor. C. Could delay immediate protective act. Immediately cleaning up the spill. D. Is unsafe without ensuring proper PPE and a clear understanding of the material involved.